You're listening to Sports Psych Talk. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect any affiliated organizations or institutions. This podcast is for informational and educational purposes only and is not a substitute for professional advice, diagnosis, or treatment. If you're facing mental health or medical concerns, please consult a qualified professional. Sports Psych Talk does not accept responsibility for any actions taken based on the content shared. Reproduction or distribution of this podcast without permission is prohibited. Thank you for tuning in, and we hope you enjoy today's episode.
Welcome everyone to the Sports Psych Talk, India का अपना Sports Talk show, and we have with us very well-known individual in the field of sports medicine and sports surgery in India, Dr. Manit. Welcome, Dr. Manit, to the podcast.
Thanks for having me.
Dr. Manit is a consultant shoulder and knee surgeon with Fortis Hospital, Chandigarh, particularly Mohali actually, and he has a very strong, academic and professional background. Published over 100 papers in international journals in the field of orthopedics and sports medicine. He also runs the clinical research program and is a fellowship director with the Arthroscopy and Sports Medicine Fellowship. He's also associate lecturer with UNE, U Queensland, and actively engaged in various societies. He serves as a chair of the ISKSAA Research Committee, and also a board member of FAS Awards and Scholarship Committees, and a board member of ISAKOS, Young Professional Task Force. He works with the various national and collegiate sports teams as a team doctor. He's also actively involving in bringing the healthcare to the most underprivileged society. This is a very long introduction, Dr. Manit, and there's so many feathers in your hair. I might have, missed a few of them. So, Dr. Manit, you've been, I myself have seen actually, actively on LinkedIn, you are very active, raising the awareness about sports medicine within the country. And this is a field, I think it is not very old within India itself. Even in Asia, we have seen past almost 7-8 years the awareness regarding sports medicine and have raised actually among the sportsmen. So traditionally, the sports medicine was about like fixing an injury. Like we have seen the ACL injuries are there, rotator cuff injuries are there, a couple of other injuries. These are the common injuries, and the goal was to set the athlete back to play. How has the philosophy fundamentally shifted today? Are we moving from just repairing to something more?
Okay, so that's a huge question. And I think one thing that's important to understand is, the term sports medicine. So we borrow this term from the West. And in the West, the model is very different because teams, they usually contract out their medical management for a season to certain hospitals. Now, in those hospitals, it's the orthopedic sports medicine doctor who's actually a fellowship trained orthopedic surgeon with an interest in sports surgery, who's their official sports medicine doctor for the season, right? And he's tasked with, running the team underneath him. And he's also tasked with managing injuries. In India, it's different because we don't have that model here. So here, in fact, there's a lot of confusion as to what constitutes sports medicine as a field per se. So I think that we need to delineate and talk about sports surgeons and sports medicine doctors. So sports surgeon is someone like me. I'm an orthopedic surgeon with an interest in sports surgery, and they constitute, the bulk of my practice is athletes and players. So for me, dealing with their injuries, and we get them sent to us by many teams and fixing them. So that's me from a sports surgeon point of view. The sports medicine doctors are actually the ones who are associated with teams per se. They're the ones who work on the ground with the team. They coordinate with their physiotherapists, their trainers, and everyone. So, and in a true sense, they're not orthopedic surgeons. So they're actually sports medicine doctors who've done their MBBS and then, subgraduated into, say, a master's or a diploma in sports medicine. So their primary role is, managing injuries instantly, and also looking after the health and welfare of the team and running the team. So there's a delineation, right, between sports surgeons and true sports medicine doctors. So, and what happens in India is that we try to overstep on each other's toes. So the sports surgeons, they get involved with sports medicine, or the sports medicine guys carry across to sports surgery. So I think the more delineated we sort of keep it, the better it is, because it allows individuals to focus specifically on their field. And this field is recent, at least in India. It sort of entered in about the 1990s, and even in the West, ACLs have been around for a long time, 1950s, 1940s, but they've been, very rudimentary to begin with. So the refinements really started in the 80s, the 90s, and the last 2 decades have seen the biggest advancement, because when a field starts, it gradually picks up, enthusiasm for it picks up, people see the results, and then everyone wants to do it. Now I go to so many conferences, and I talk to a lot of young surgeons who are just graduating from their residency program, orthopedic surgeons, and the bulk of them are interested in sports surgery as a career. So there's a huge amount of enthusiasm. The number of ACLs is increasing as well, as more and more people are doing it. And so we have to keep abreast with the latest technology. So, that traditional thing of you've got an ACL tear, it needs to be fixed, doesn't really hold true. So there's copers and there's non-copers. People, I have 10-year follow-ups of my patients who have had complete ACL tears are copers, doing well without any osteoarthritis and without any secondary damages. So it's really important to figure out, one, who needs an ACL surgery, and two, when you're doing an ACL surgery, what is the new things, the new advancements that we're adding into it. So the big thing that's come about in the last sort of 5 years or 7 years is something called LET, which is lateral extraarticular tenodesis. So basically now we know in 2025 that an ACL injury is not just an ACL injury, but it's an ACL combined with an ALL, or an anterior lateral ligament injury. So when the knee pivots, it ruptures your ACL, and it also ruptures this ALL. The ALL is much, much weaker than the ACL. So we've been making ACLs for a long time, but they have a high failure rate. So LET was introduced to reduce the failure rate. And we've been using it in our practice over the last 5 years for patients that are, highly active individuals or athletes, to give them more rotational stability in their knee. So that's one thing which has come about, and that's reduced failure rates by 3 times. The other things we explore is things to either mechanically or biologically augment an ACL reconstruction. So mechanical augmentation in the form of synthetic or biological scaffolds, and biological augmentation in the form of PRP or bone marrow aspirations, right? The third thing which has come in is something called ACL repairs. So if you have an athlete who has a tear of their ACL, which is not a mid-substance tear, but a femoral-sided tear, and it happens and they come to you within the first 3 weeks, they've got good tissue quality. For those people, we do an ACL repair. We basically stitch that entire ACL stump back to its docket onto the ACL. And, these are sort of, the 3 big things that are happening in ACL: LET, ACL repair, and mechanical and biological augmentation of ACLs.
Yeah, this is pretty interesting actually, because I've been myself working in the field past almost now 12 years, and there are many occasions when I've seen the players getting injured, while they are training.
Yeah.
Divers are just slipping over the board, and the shot putters are trying to, like, overtrain actually on a certain day, trying to throw more. and they
Yes.
find themselves struggling with their body momentum, unable to control at the block, and then that flexion and twisting take place, and they see that ACL is gone, MCL is gone, even meniscus is mostly involved in the injuries. Uh, uh, these are some of the things actually you have already mentioned about the revolution which is taking place within the sports. And the first thing is the distinction between sports medicine and a sports surgeon. Um, uh, one small question which I want to ask you here. So there's a big field which is called orthopedics, and most of the healthcare professionals and the people around the healthcare system, the peripheries, they are aware of the orthopedics. And how the sports surgeon, is it a branch of orthopedics, particularly deal with the sports injuries? And does ACL fall particularly within sports only, and it is very less common in a day-to-day life with the regular people or laymen?
Yep. So orthopedics is a big field, and in that you have different verticals. So, for example, spine surgery is one vertical, sports surgery, joint replacements, and there's people who are now, the world is changing, India is changing. So in the West, you have specialty specific practice, subspecialty specific practice, which means if I have an ACL tear, say I'm in Australia, I have an ACL tear, I would not go to a general orthopedic surgeon. I straight away know that I've got an ACL tear, and I'll go to a ACL specialist or a sports surgery specialist, right? In India, we're sort of 10, 15 years behind that. In tier one cities, they catch up faster than tier two, tier three. So, but that redistribution is happening. So now people that come to me, I don't get people that come to me with back pains. I don't get people that come to me with, arthritic knees. These are people that come to me and they say, I've got a ligament tear and that's why I'm here. So I'm in Chandigarh, a tier two city, and already in the last, sort of 10 years since I've been here, I've seen a dramatic shift in the way that, people, at the start, we used to get this wide variety of, ailments. With time, it's become much more filtered. And people know that, okay, I've got a ligament problem. This is the guy I want to go and show because he's an expert in that field. So I think that change is already happening. And in the next sort of 10, 15 years, across tier one, tier two, tier three cities, you're going to see a subspecialty driven practice. I think the days of being a generalist are fading away as more and more people are playing sports, definitely. But we get a lot of people that come to us with trivial injuries as well, like wet floor in the bathroom, slipped, got an ACL tear, going downstairs, tripped, got an ACL tear. And also the sort of bigger injuries, the multi-ligament injuries, are the ones that are coming to us after two-wheeler accidents. So I think two-wheelers are one of the most important causes of a multi-ligament injury in India. And the amount of people that come to me that I fell from an Activa, fell from a scooty with a multi-ligament knee injury, I think that has increased a lot over the last sort of 10 years, I would say. Yeah.
Yes, actually, this is the most discussed already, the highlighted kind of injury in sports itself. Whenever we talk about injury, we all see, that ACL comes on the top. There are many other injuries which are very common, and it depends from the sport to sport. And there is, since the competitiveness is increasing, and we see number of injuries are also increasing. There are multi factors, things are involved in sports. Other aspect is always prevention, prediction. We are not touching upon that prevention and prediction of the injury. So I myself been involved in sports psychology. So from my chair, what I have seen, the physical healing after injury is one aspect. The player gets injured, they go through the procedure, go through rehabilitation, lots of ups and downs, and we also start connecting with the athlete. Sometimes we feel like athlete is lucky enough, or we are lucky enough, in fact, we, are present on the spot when players, get, met with an injury. And later, through that entire process of making a decision to go to a surgeon, go through procedure, and then during the rehabilitation phase. The biggest barrier we have observed that is a fear of re-injury, loss of confidence, anger, irritability. Other issues are also there, like, a lot of, identity crisis, and I would say the reiteration of the past achievements. They start bragging a lot about their past achievement. I was this and I was that, and a lot of confusion is around audacity to make early return to play. So these are some of the psychological challenge. Do you see these things among the athlete, these challenges manifest at your setup or clinic or hospital?
Yeah, all the time. So all the time I see that. And I think, what I tell patients and players especially is that 50% of the battle is here and 50% is at your knee. So, you can have a wonderful knee, but if you're not mentally ready here to play, you'll never be ready. And so we have people that have excellent post-operative MRIs, excellent clinically, excellent quadricep strength, and just the fear they're not able to play. I have a patient who's 3 years down the line. He's had three different MRIs, completely good knee from the inside. His quads are bulky, his hamstrings are good, he's got good stability. He's cleared all the functional tests to return to sport, but just can't do it because of this. So his mind inhibits his ability to get back to sport. And there's some people, as you said, the audacity of early return to sport. I did a ACL for a player, kabaddi guy, and this is about 3 years ago. And after 3 months, he was playing kabaddi. So, and he still continues to play. He wins trophies, and he's always sending me this. But this is not what we recommend, right? We don't recommend people to go back after 3 months to of an ACL way too soon. So, I think it's the role of a sports psychologist is very important. And I think that your field is going to gain more importance as time goes on, because people are going to understand that, there's no point of fixing injuries if the player themselves aren't mentally going to ever get back to sport.
Yeah, I think it sounds pretty good. In terms of sports psychology is also at in India at infancy. It is just still kind of growing. We
Yeah,
also need to do a lot of work to raise the awareness, just not among the athletes, but all the stakeholders, those who work within the field. Interaction with the individuals like you is also important. That we understand the mindset of each other, practices of each other, what we can learn from each other. Uh, this is one thing. So what I have noticed, actually, I myself been recently to 40s actually. So I have gone through the details on the board here and there. There's so many people who work in a different departments. You also work with the very big team in your
yeah.
department, and that's the key. Actually, that's very important that you have team and you are able to extend more support. Can you just describe who's the team, like the physios, or maybe you have a separate section for other people are there, or is there a sport injury psychology? Like myself, my area of specialization is sport injury psychology. My PhD is on sport injury psychology. So do you consider it a standard part that a sports medicine unit within a hospital or anywhere in the clinic must have the group of people who, holistically address an injury at time whenever it is required for the athlete?
I think in an ideal world where you have ideal space and you have ideal funding and you have ideal resources available, a complete sports medicine department should have, an orthopedic surgeon, a sports medicine doctor, um, 2 to 3 physiotherapists, including a head physiotherapist, an athletic trainer, a strength and conditioning person, a sports psychologist, and a sports nutritionist. Now, this is me living in a fantasy world where I believe that this will ever happen one day. So the problem with the setups that normally orthopedic surgeons, and you can have wonderful orthopedic surgeons, but the problem with most setups that we walk into, they're space constraint, they're funding constraint, and they're time constraint. So the management, I've been pushing them for the last sort of 5 years that we need to develop a sports medicine, a completely different area which is purely just for athletes. And we just don't have the space for it. So we're building a new building which will be ready in 2-3 years. And in that, we've already got a space. But up until that doesn't happen. So it's hard to fit it into the space that we have currently. Plus, you need a place where the management is also supportive for you to, achieve the vision that you have planned. So for me, that is the ideal setup, and it's where athlete comes in. X problem can be solved within that team.
Yeah, actually, it actually fascinating to even imagine such kind of facility. I myself have actually seen the player gets injured, he have a lot of difficulty basically finding experienced sports surgeon. That decision making is very crucial, and luckily we have good amount of well-known sports surgeon in India. You are one of them actually. Who've been involved in this entire domain actually for some time. So that is one challenge. Athletes goes and interact with the team. Doctor go through surgery. We are actually very less aware of. Physios are not connected. He go to other place and try to just reconnect over cell phone. A lot of communication issues take place. We have to go through a lot of the history of the athlete. We even
I
don't
think
know
it's
actually.
very
I myself have understand the potency of different graphs actually which you use. Actually recently I have seen one of your posts on LinkedIn where you have tried something related to synthetic. I don't know what synthetic means here. Maybe
correct.
some different type of technology have
Scaffold.
arrived. Yes. So everyone need to understand this potency of the material being used and from where it is being taken. If we just have to particularly say talk about in this podcast ACL only. ACL is a very big and common injury. There are shoulders also there. The shoulder comes with very different type of problems. uh, this very mobile joint, and chances of re-injury is also very common in shoulder. If we make early return to play, need to be very cautious about the approach a physio takes. That connection has to be there between physio and sports medicine or sports surgeon, and that is only possible if we see the hospitals, especially particularly the big hospitals, start giving a thought to such kind of facility where a proper unit is there. And I think it will be wonderful to see Fortis Mohali, very well known, very popular hospital, and I hope to see a sports medicine unit over there. It will be very easy for a lot of people all over India. I think the athletes will visit. They are already visiting actually. I know a couple of your athletes, they coming from here and there, Bombay, XYZ areas. Uh, so it'll be very easy for the athletes to come, make stay over there, have some comprehensive program of 6 months, something like that, and they pay, and they stay, and they have physio, they have they have sports medicine guy, nutrition, psychologist, and all these people are working. Even maybe a biomechanist, or as well in the team sports biomechanist. If we have a motion analysis lab over there. Uh, Looking into this 5-10 year ahead, actually this is one of the possibility we see, and we also get excited about it. Uh, is it like some the technology have advanced? Actually we also adopted AI, machine learning. Gradually we see that a lot of changes are taking place, and personal rehab also, virtual reality, motor learning systems. I have not no big exposure of AI or VR, AR, XR systems, but this is one of the possibility where we see that virtual reality, augmented reality, and the mixed reality type of things are coming up for motor learning and pain. How you look at this horizon?
So I think the future of orthopedics and sports medicine both is AI driven. So, and I think the earlier that we adopt it and the earlier we start using it and integrating it, the easier the next, 10, 15, 20 years will become. And it definitely has certain advantages, and it also has certain disadvantages, and you need to know how to use it properly. And I think that I don't know if you know this, but robotics also is being more and more involved. So the combination of navigation, robotics, AI, and everything is going to drive the future. If you know this fact, so did you know that a robot is capable of self-learning? So what it does is that so for example, if you're doing a laparoscopic cholecystectomy, so you're removing the gallbladder, right? And you're doing it robotically. So what the robot does is that for you as a surgeon, you'll start using it, right? And it'll learn with you. So as you are learning, it learns with you, and then it anticipates what you're going to do next. One. Second thing is it's able to machine learn its own problems. So it can learn that last time I didn't do this properly, so I should do this, like we as do as intelligent minds. And so the robot then feeds this data into itself, and eventually as time goes by, the surgeon will go away, but the robot stays for eternity, and it'll continue to machine learn, continue to get better. And I see that 50 years from today, knee replacements, hip replacements, they're all going to be done by robots. You'll have surgeons standing around and looking after a lot of things, but it'll be a completely robotic driven practice, because it will machine learn itself to the point where it can just do everything by itself, and it can anticipate complications. And even if there is a complication, it can address those complications because it's learned so much in 50 years. So today we're in 2025. I don't know how many of us will be around, but 2075, right? Or even earlier than that, I think you'll see an era where orthopedic surgeons, at least for these type of surgeries, they will no longer go to the OT. They'll go to the OT just to see the patient, hello, hi, go inside, and then the robot is doing the entire surgery, and then they meet the family afterwards and everything. So I think that's what's going to happen over the next 50 years. And I think that where we are today, we've just started this. So I mean, if you have you ever seen Terminator? So what happens eventually? The machines take over, right? So that's the era that we're going into, because now you've got these robotics and you've got this AI, and then what's going to happen is that both those entities will combine. So you'll get robots driven by AI that can machine learn, which is Terminator.
This is absolutely from science fiction, and we see this is unfolding
Right.
in front of our eyes, and I feel very lucky also that born brought up in 90s, 80s, 90s, and I'm able to see such drastic change in 20 years. The entire world is going to. We are already witnessing. I know many robotic surgeries are nowadays at 40s hospital ward. The equipment is at place, and doctors are using those equipments on the patients. But for athletes, this is also very emotional. The injury is very emotional, psychological. But I think the generation who is going to adapt to it for the betterment of sports itself, and we cannot deny that this is happening. Absolutely, the overtaking everything gradually with the AI and machine learning is one thing. Uh, so, Dr. Manit, we are moving almost the end towards the end of the podcast. I have just left two more questions. One is for the youth athletes.
Yeah.
Dedicated weekend where they are, work with almost the spectrum of the athletes, from the top of the top athlete in India and at the grassroots. But majorly, past 5 year, almost 6 year, I devoted much of my time with the youth, because I find that very easy to work with. Elite and the high performing athletes have an absolutely different kind of requirements, and you need to have a very different kind of skill set not as a professional that you know psychology or you know this and that, but I think your behavior is more important to them. Uh, so my work with the young athlete and my, what I have witnessed regarding, is there any piece of advice for them? Because I've seen number of injuries are increasing among the youth as well. Mm, I don't know what is going on there.
Yeah. So
Yeah.
young mind is a nascent mind, and young minds are adaptive to new learning pathways, which older minds are not. And that's not applicable just to sports, it's applicable to life as well. So there's a saying, you can't teach an old dog new tricks, right? Which is very true. So in that early phase of a dog's life, which is that first 1 year when they're a child, when they're playful, you can set good learning patterns for them so that they follow it for the rest of their life. And the same thing applies for humans. So the earlier that you set good learning pathways, the more likely they are to follow it. And luckily, I would say, that you're investing your time in youth, because the these people, the youngsters now are going to become the players of the future, right? So at least from an early age, they understand the importance of various different types of fields and learning pathways, and they're going to become more appreciative of that. So remember, the people, the athletes that you're dealing with who are stubborn to learning new things are the ones who never had this 10 years ago, right? When they were growing up, they never had somebody come down to them, talk to them, educate them, which is what we're seeing now across. I have so many orthopedic surgeon friends. I keep seeing their posts. They're going to youth camps, doing talks, and I think it's wonderful because you're really educating this, and this sort of thing never happened 10 years ago. So the players of today are stubborn because they've never had that learning, which was supposed to happen when they were young. So I'm so happy to see that, orthopedic surgeons and allied health and everyone is going and meeting these youth players and educating them, because they really are amenable to learn, and they're going to be carrying this into the future as they grow, and they'll incorporate it into, so you'll see a athlete 10 years from today much more receptive because they've had that ingrained new learning pathway developed earlier.
So do you see like young, the athletes approaching you? Because I see that young grade two tier, shoulder
Yeah.
injury.
We get a lot
Sometime
of
ankle.
youngsters that have ACL tears, and not everyone, as I said, needs surgery. So there's certain people that are at higher levels in their performance, even at a young age, that do need us stability restored immediately. There's others in which we can take time, so we walk them through that conservative pathway, get the rehab guys involved, and just see how they track over a period of time. So a lot of partial ACL tears, because remember, your ACL is more elastic when you're younger. It's able to self-heal as well when you're younger, which doesn't happen when you're older. So in the youngsters, very rarely we need to perform any surgery.
Yeah, Dr. Manit, older mean how older? Like, can you just
So so everybody wants a magic number, but there's no magic number. So the once you hit about 18 to 20 years of age, the capacity for self-healing diminishes rapidly. We know that with a lot of studies now. So 18 to 20 is a good hallmark. For people before that, there's still capacity to heal, especially if you're 12, 13, 14. There's a lot of capacity to heal. But once you cross 18, that capacity changes. And so if you want an arbitrary figure, it would be 18, but a range would be 18 to 20.
just for example, actually, because I also see athletes day to day life. If I give you an example, so I know somebody, 26-year-old, a sport which involves each and everything it involves actually. I may not mention the sport and the name of the athlete, because I know athletes who have some anomaly developed at the acromioclavicular joint. The pain is here. Some thickening of the structures around is there. Tear is there. And the sports meds guy, they recommended him to work more on the strength, and so that it stabilizes the structure and distribute the forces and create less impact and give time. to that structure to heal. Is it possible that you are actively training, lifting a lot of weight, overhead activities on the same time you expect, okay, I go to the training and then this overhead, this movement of the shoulder is involved, and you expect that structure to stay as it is, and it just heals under that pressure, under that load, and there is no chances
So
of injury.
this is just like a fictitious scenario because I don't know exactly what structure you're talking about or what the condition is, but
Let's say labrum grade 2 tier.
so labrums can't have gradings of tiers. That's the thing. So a labrum, when somebody says, it's a grade 1, grade 2, grade 3 tier, for labrum that doesn't exist. That's just a radiological way of assessing the tear. A labrum will either be torn or it will not be torn. So I think you're talking about maybe a slap 2 lesion, right?
Yeah, slap to slap. Sorry.
Yeah, yeah, yeah. So a slap 2, yes, it has the propensity to heal, right, with conservative. And, we don't jump in straight away also. We give them 3 months of a proper rehab program. And you have to, so if anything ruptures, it will start to stick, right? And the way to think of it is like a fracture. A bone breaks, right? And then it will start to stick, right? Now there's something which comes into it called Wolff's Law, which is that a bone will remodel itself according to the stresses that are placed on it. Now, if you do not load a healing bone, it will never remodel properly. So that's the same thing with connective tissue to bone healing. So if we do not load it at an appropriate time, it will not remodel properly. For example, latage, right, which is a very common procedure in contact sports, which is for dislocation, anterior instability of the shoulder. So what we do is we transfer the coracoid and put a screw or 2 screws in. Now, if you don't load it, the graft resorbs. So we have to allow the graft a little bit to heal, but then we start their progressive loading onto it so that remodeling does happen.
Yeah, thank you so much actually for this clarification. I have just hypothetically tried to give you an example of some of the athletes. There are different type of athletes. So any advice for the coaches and the parents in the last of the athletes?
Stay healthy, stay fit, continue to live your sport and do your dreams, but be in touch with good people and try to learn new things, especially for people that are devoting time to come and teach you things. I think it's very important. Pick up as much as you can and incorporate that into your future.
Thank you so much, Dr. Manit, for your time. And I think this podcast is going to, spread awareness among sports psychology community as well and others as well. So go. I just want to tell my audience, go watch this podcast on YouTube, Spotify, and there are pages on LinkedIn, Instagram, Facebook as well. You can follow the information over there. Once again, thank you so much, Dr. Manit. Have a good